Turning on to our COVID-19 situation, today we have tested 2,718 samples, out of which 259 people have tested positive for the virus. The cumulative number of tests conducted so far stands at 165,196,000, and the total caseload for the country right now is 6,070. So we've now surpassed the 6,000 mark. All the positive cases are Kenyans, except 3 foreigners, 159 being male, 100 being female. And in terms of age, the youngest is 8 months old, whereas the oldest is 92 years. The 259 cases are distributed as follows by county: Nairobi leading with 127 cases, Mombasa 39, Kiambu 22, Machakos 16, Busia 11, Makueni 9, Nakuru 9, Uasin Gishu 9, Kilifi 5, Kajiado 3, Kisumu 2, Lamu 2, Garissa 2, Marsabit 2, and Kwale 1. And in terms of sub-counties, again, I'll jump into the key high-load burden areas. In Nairobi, out of the 127, Westlands, again, is leading with 31 cases, Dagoretti North, 22, Makadara, 12, Embakasi East and Langata having 11 each. In Mombasa, the 39 cases are from Likoni. We have Likoni, having 13 cases, Mvita 8, Changamwe 7, Jomvu 6, Nyali 4. And in terms of Kiambu, the 22 cases, 8 from Thika, 6 from Kiambaa, 4 from Kiambu Town, Juja, Kabete, Lari, and Riru all having 1 case each. In Machakos, the 16 cases, we have 15 from Athi River and 1 case from Machakos Town. In Busia, out of the 11 cases, from Teso North, we have 9. In Makueni, the cases that we have, Kibwezi West has 7. And in Nakuru, out of the 9 cases, in Naivasha we have 4, in Nakuru East we have 3, Rongai 2, in Uasin Gishu we have 3 from Ainakiboi, Kapsaret and Tubo have 2 cases. And in Kilifi, the 5 cases in terms of disaggregation, Kaloleni and Kilifi South have 2 cases each, and Malindi has 1. And in Kajiado, the cases are in Kajiado North, where we have 2, Kajiado Central, we have 1. Lamu is the latest county to report a case, bringing the total number of counties in the country that have COVID-19 cases to 41. So we now have 1 additional county, that's Lamu. We are happy to report that we've discharged 35 patients from various hospitals, bringing the tally of recoveries to 1,971. Unfortunately, we have lost 2 more patients to the disease, bringing the total number of those who have succumbed to 143. And our thoughts and prayers are with the bereaved relatives and families during this difficult time. And our strategy really has evolved and moved towards having a community-facing front. And yes, we have actually trained 60,000 community health volunteers. This training was conducted primarily through an online platform known as LEAP, in cooperation with our partners in AMREF and different other developmental partners. And it's important to know that these volunteers have actually been volunteers who've been in the system, who have undergone a community health volunteers training module. And so these are not necessarily new, entrants into the health system. And so by virtue of them having experienced and worked with us and our different partners, they were then able to understand in terms of what was required of them from this platform. With regards to PPE, I'm happy to say, again, in cooperation with our partners, in particularly AMREF and different other organizations like Rockefeller, there are efforts to ensure that these community health volunteers actually have the requisite PPEs as they support us in the fight against coronavirus. For us to be prepared as a country, we've really highlighted this, and I think this was also articulated by the President in his summit with the governors, that really opening is really contingent on county preparedness. The fight has moved. The fight has moved from Nairobi. As we say today, we are at the 41st county in terms of having positive cases. And so counties need to be ready. And what does this preparedness look like? Like we said, 1, testing becomes important. And I think from the beginning, when we started with our 2 labs, now to almost more than 27 labs, we've improved there. And now in terms of supply chain shortages. I think we almost have, a good number in terms of the tests available. And so in that regard, we are hopeful that at least there we can put a tick, that we are prepared. We do have the requisite, should I say, strength and force and numbers in terms of testing. However, it's not just the PCR testing. We need to look at also what we call surveillance, syndromic surveillance within the community. And this is where our community health volunteers come in. And again, I'd say we tick this box. We have 60,000 of them up and ready trained. They're deployed in different counties. They are actually under the instructions of the county departments of health, and those are the people who offer, monitoring and evaluation services for these teams. So again, in that regard, we are ready. And then the key element in terms of treating. Right now, again, as a country, I can say we are sufficiently ready when it comes to treatment. We do have our case management protocols. We've shared them. We have our experts who contributed to these protocols. And we have actually had experience managing and having close to over 1,000 recoveries. So we know what it means to be able to treat and manage both an asymptomatic, mild, moderate, and severe COVID case.
Currently, we have 28 laboratories spread across the country offering COVID-19 tests, both in the public and the private sector. And we want to enhance this further. Initially, we thought that we'd be able to get the gene expert cartridges, which are placed all over the counties throughout the country. But where we expected to get these cartridges, we have hit some headwinds. But that notwithstanding, we still have a proper sample referral system that is in place. That is why we can be able to test a sample from Turkana or from Mandera, however expensive it is. So it simply tells you that the government will not leave anything to chance if it comes to the issue of testing, which is critical for stopping the transmission, because it is only after testing that will determine who is positive, who requires isolation, and who requires to go for quarantine. The public health and social measures that we need to undertake, including inter-county movement, which again we throw this responsibility to the governors. And we have developed simple templates at the points of entry, like if you are crossing from, say, Kiambu to Murang'a County, we have a simple checklist. You'll have your temperature checked. And of course, there's also a triage system, simply asking you whether you have cough or difficulty in breathing. We'll be able to pick about 80% of the COVID cases. So this is simple application which will not require a lot of resources. And we think if we can be able to do this, then it is very likely that we'll open the economy. And the final pillar, of course, is infection prevention control measures that Madam Waziri has articulated very, very well, but with a focus to be able to shield the elderly and the vulnerable. And we are telling the counties that the resources we have given you, we can be able to map out the elderly people or those with pre-existing conditions so that you can be able to supply them with masks. And because manufacturing or local manufacturing of masks is now taking place at the county level, even cloth-based masks would equally do a good job.